Hello everyone. Today we are going to study CNS and microbiology. So there are mainly going to be around 4 to 5 video lectures on this. This first lecture covers the basics of the CNS. So the basic anatomy of the central nervous system. So there are mainly 3 layers which are included. The outer is going to be the dura mater. The middle layer is going to be the arachnoid space, and the most inner is going to be the pia mater. Okay, there are other layers which are included in the epidural spaces. It can be the subdural spaces, or it can be the subarachnoid spaces. Okay, so if there is an infection, there has to be different agents which cause it. So there are mainly 4 agents: bacterial agents, viral agents, parasitic agents, and fungal agents. Okay, bacterial agents mainly cause shunt infections or brain abscess. Viral agents cause encephalitis and meningitis. Parasitic agents cause lesions, encephalitis, and rarely it can cause meningitis. Fungal agents only cause meningitis. Okay, so what are the different routes? Okay, routes by which infection can be spreaded. Okay, so this includes the hematogenous spread. Okay, this is the most common route. Okay, most common route of infection. So how does it spread? It enters into the subarachnoid spaces. Okay, through the it enters the subarachnoid spaces through the choroid plexus. Okay, and then it spreads to the different parts via blood. Okay, so first the hematogenous spread. The second can be direct spread. Okay, direct spread. The direct spread means like it affects a specific organ or a part of the body, like the otitis media. It can be the mastoiditis, which affects the mastoid process, or sinuses. Okay, or there can be only anatomical defects. Okay, the anatomical defects which can cause spread, like if there is a spread during a surgery, or when there is a trauma to a patient. Okay, or there can be any congenital defects. The fourth method by which it can be spread is direct intraneural spread. Okay, so it directly affects the neurons. Okay, like if you know, when a dog bites, we can get rabies. So rabies is a main disease. We'll study about rabies in deeper in the next lectures. Okay, or it can be herpes simplex virus. Okay, so we'll just revise it. So what are the different routes by which infection can be spread? Okay, what is the most common? It is hematogenous spread. Okay, the most common route. How does it get spread? The infection or the agent enters the choroid plexus. Okay, then it goes into the subarachnoid space, and then it goes to different parts via the blood. Okay, so the choroid So it's the choroid plexus, then the subarachnoid spaces, and then the different parts of the body. The second is going to be the direct spread. Like it affects the parts of the body, like the mastoid process, which can cause mastoiditis. It can affect the sinuses, which can cause sinusitis, or the part of the ear, which can cause the otitis media. There can be the third is like the any anatomical defects which can cause infection, like during the surgery or trauma or any congenital defects by born. The fourth is direct intranasal spread. This is the least common method of spread of infection, but there are mainly two organisms or two diseases by which spread can occur. One is the rabies and the second is herpes simplex virus. Okay, now we are going to study in basic like what are the different infections which can be caused in CNS. Okay, so different infections of CNS. Okay, so the most important, meningitis. Okay, meningitis. So what is meningitis? By the word meningitis, itis, so it is going to be the inflammation of the meninges. Okay, so meningitis is the inflammation of the meninges. Okay, so there are mainly three type of meningitis. It can be either acute bacterial meningitis, it can be acute viral meningitis. Okay, meningitis, or it can be either chronic meningitis. The causative agents will be for acute bacterial meningitis will include pneumococcus, H. influenza, meningococcus, or streptococcus agalacea. For acute viral meningitis, it includes mainly herpes virus and enteroviruses. Chronic meningitis will include bacterial agents like Mycobacterium tuberculosis, or viral or parasitic or fungal agents. The fungal agents will include Cryptococcus. Okay. The second type of infections which can cause is encephalitis. Okay, encephalitis. So there are mainly encephalitis which are caused by viral agents like herpes or rabies, and the third is going to be your encephalopathy, which are slow virus infections or cerebral malarias. Fourth will be your lesions, which including the CNS. They can be either focal CNS lesions. Okay, focal CNS lesions, or they could be cystic parasitic diseases. Okay, so in focal CNS lesions, they include brain abscesses, subdural empyema, or epidural abscesses. In cystic parasitic diseases, they include neurocysticercosis or cystic and echinococcosis. The other infections which can be caused in CNS will include your CSF shunt infection. As studied earlier, these are mainly caused by bacteria. Okay, then it can be your myelitis, which include the inflammation of spinal cord. Okay, spinal cord. Okay, like polio, which causes inflammation of spinal cord, or any neurotoxins, right? So neurotoxins can also cause infections like tetanus, another most IMP, okay, and botulism, okay, botulism, okay. So the different infections of CNS will include meningitis, encephalitis, encephalopathy, lesions, or even. Okay, so now we're going to start with meningitis. Okay, so first we'll just revise the basics. Okay, the CNS, there are mainly three layers: the dura mater, the arachnoid, and the pia mater. Okay, there are mainly four agents which cause CNS infections, which include bacterial agents, viral agents, parasitic agents, and fungal agents. The routes can be hematogenous spread, so most common via blood. It can be the direct spread, anatomical defects, or direct intraneural spread, which are the most common. The different infection caused are meningitis, encephalitis, encephalopathy, lesions in the CNS or different like CSF shunt infections, myelitis, which is the inflammation of the spinal cord, or toxins like tetanus or botulism. Okay, so now we are going to start with meningitis. So meningitis. What is meningitis? It is the inflammation of the meninges. Okay, inflammation of the meninges is known as meningitis. Okay, so three agents which cause meningitis are bacterial agents, it could be viral agents, or even it could be fungal agents. Okay, now we are going to be starting with bacterial agents first. So the manner how I'm going to teach you is we're going to first study bacterial meningitis, then viral, and then fungal. I'm going to teach you different organisms which cause them, the clinical manifestations, the factors which can cause it, and at last I'm going to tell you the lab diagnosis of meningitis. Okay, so what is the different type of bacterial meningitis? Okay, so bacterial meningitis is the first topic. So there are two type of infections. So acute bacterial infection, acute bacterial meningitis, also called as pyogenic meningitis, or it could be chronic bacterial meningitis. Okay, we're going to be starting with acute bacterial meningitis. So what are the routes of infection through which it can occur? I'm going to be teaching you short, so just read your books whichever you are referring. So I'll just write, you can take the notes also. Okay, so it's going to be short. Okay, so the routes are going to be the hematogenous route. Okay, it can be your direct spread, or it can be your anatomical defects. Okay, these are the three main, which are the hematogenous spread, the direct spread, or anatomical defects through which acute bacterial meningitis can occur. Okay, so this is going to be a first point, routes of. Then what are the factors which can cause meningitis. Okay, so it can be your age. Okay, the main causes which affect the age are like their immature immune system, or like any colonized organisms in the mother when they are giving birth. Okay, or any increased permeability of the blood brain barrier. Okay, second is going to be vaccination. Okay, nowadays due to the vaccination programs, it has decreased the number of meningitis, like H influenza meningitis, due to the HIV infections. Okay, or if there is any breach in the blood brain barrier. Okay, so if there is a breach in the blood brain barrier, the organism can enter the body, and then it can cause the integrity in the loss of capillary. Okay, it can transport through the phagocytes and affect the body, or it can even cross the endothelial cells by the transport through the vacuoles also. Okay, so what are the factors? It can be your age, vaccination, or even it can be a breach in blood brain barrier. Okay, now what are the clinical manifestations? The clinical manifestations included in meningitis. Okay, so what is the incubation period? It's going to be ranging from 2 to 10 days. Fourth day is going to be the most common, as we see in the day-to-day life. Okay, now the important symptoms is going to be fever. Okay, fever, vomiting, alterated consciousness. Okay, these are the most important symptoms, which are fever, vomiting, altered consciousness. Sometimes it can be also photophobia. Okay, so if a patient comes in a clinic, then how will you say that the patient has meningitis? Okay, so there are around, so to know whether the patient has meningitis or not, you should know 3 signs. Okay, signs caused in meningitis. Okay, 3 signs which you should remember. 3 signs of meningitis. The 3 signs which are included is going to be knuckle rigidity. So what is knuckle rigidity? It is stiff neck. Okay, so the patient is not able to flex their neck, so it is a resistive passive flexion of the neck. Okay, the second sign is going to be Carnegie's sign. Okay, Carnegie's sign. Okay, sorry, continue. What is Carnegie's sign? So Carnegie's sign is known as the stiffness of the hamstring muscles of the leg. Hamstring muscles. Okay, so cardiac sign is a serious stiffness of the hamstring. Okay, what does it cause? Inability to straighten the legs. Okay, and the fourth sign is going to be Brudzinski sign. Okay, so when the neck is passively flexed, okay, it causes the flexion of the hip and the knees. Okay, so what is Brudzinski sign? So Brudzinski sign is when we flex the neck of a patient. Flex neck of the patient, it will cause spontaneous flexion of the hip and knees. Okay, so I'll just show you a figure which wait a minute. Sorry, yeah. So this is Brudzinski sign, the flexion of the hip and knees in response to neck flexion. See, so when you flex the neck of a patient, it will cause the flexion of the hip as well as the knees. And cardiac sign, it is a resistance to extension of the leg while the hip is flexed. Okay, so there are three signs which are knuckle rigidity, which is the stiffness of the neck; cardiac sign, which is the stiffness of the hamstring muscles; and Brudzinski sign, which is when we flex the neck of the patient. It will cause a spontaneous flexion of the hip and the knees. Okay. Now, what are the complications? Which can be seen in meningitis. It can cause decreased consciousness. It can even cause seizures or increased intracranial pressure. It may even cause stroke in a patient. Okay, so complications include decreased consciousness, seizures, increased intracranial pressure, or even stroke. Okay, now what are the agents? Which cause acute bacterial meningitis? Okay, it includes pneumococcal meningitis, which is caused by Streptococcus pneumoniae, it is mainly seen in adults of more than 20 years of age. the second agent, which is meningococcal meningitis. Meningococcal meningitis. The causative agent is Neisseria meningitis. So the causative agent is Neisseria meningitis. Meningitis. Okay. The third infection is going to be Haemophilus influenza. Okay, so nowadays this infection is not seen due to the nowadays this H influenza meningitis is not seen or decreased due to the effective vaccination. Okay, so there are mainly three organisms which are pneumococcal pneumonia and pneumococcal meningitis, meningococcal meningitis or Haemophilus influenza. Okay, now chronic bacterial meningitis. Chronic bacterial meningitis. So when there is CSF abnormalities, which are present for more than 4 weeks, it leads to chronic bacterial meningitis. Okay, so what can lead to chronic bacterial meningitis? These include partially treated acute meningitis, treated partially. Okay, it can be Mycobacterium tuberculosis, it can be Lyme's disease, or even tertiary syphilis, which can lead to chronic bacterial meningitis. Now, what are the clinical manifestations which are seen? Okay, clinical manifestations. Which is going to be your headache, stiffness, back pain, back or neck pain, it can be hydrocephalus, which means accumulation of CSF within the ventricles. Okay, it can be even neuropathies like diminished vision or optic atrophy or hearing losses. It can be radiculopathy, which leads to arms or leg weaknesses or numbness, or even it can cause urinary retention. There can be personality changes which can be seen. Personality changes which can be seen, like drowsiness, inattention, disorientation, or even memory loss. Okay. Now we are going to see the different agents which cause chronic manifestations in detail. So the first is going to be N tuberculosis. It accounts for about 5% cases of meningitis. It is seen in young children, in adults, seen in those which have HIV. Okay, so and tuberculosis has two forms. Which include tuberculous meningitis, meningitis, or even it can be tuberculoma. So what is tuberculous meningitis? Okay, it is seen when there is primary spread of TB. The clinical manifestations are seen like headache, mental changes, low-grade fever, night sweats, anorexia, or irritability. There could be cranial nerve paralysis, which can lead to coma, or hydrocephalus, which is accumulation of CSF in the ventricles, or even it can cause intracranial hypertension. Now tuberculoma. It causes space occupying lesions and can lead to seizures or focal signs. Now the second is going to be Lyme disease. The causative agent is Borrelia burgdorferi. It caused due to tick bite. Okay, caused due to tick bite. The manifestations are mainly seen after months or even weeks. If the patient is left untreated, which can cause deep frank neurologic abnormalities. Okay. Now syphilis. In syphilis, it is seen in tertiary syphilis. Okay, so now we are going to start with viral meningitis. So the meningitis which occurs due to viruses is known as viral meningitis. So which are the agents which cause viral meningitis? Okay, so these could be herpes virus, which include herpes simplex virus. It can be Varicella zoster virus. Even it could be Epstein-Barr virus, EB virus. Okay. Arboviruses also cause viral meningitis. Okay. It could be LCM virus. LCM stands for lymphocytic choriomeningitis virus. Okay, and the others will include mumps, virus, influenza virus, or human immunodeficiency virus, HIV. Now, who people are at higher risk? So, children below the age of 5 years. So, people at risk include children below 5 years of age, okay, or immunocompromised people, like people who have HIV or have are going through any chemotherapy. Okay, so HIV patients, patients going through chemotherapy or have gone under any organ transplantation. The clinical manifestations are the same as those seen in bacterial meningitis. So these include headache, fever, stiff neck, photophobia, sleepiness. Okay. Now we are going to look into detail of the agents which cause viral meningitis. So the first agent, which is the most common agent, is known as non-polio enterovirus infections. Okay. Non-polio enterovirus infections. So these are the most common, affect about 85% of the cases. Okay. These affect any age group, so it's not necessary it should be a child or an adult or a geriatric patient. Okay, so non-polio enterovirus infections consist of different viruses. So these are Coxsackie viruses, it could be eco viruses, or it could be enteroviruses. Okay, so now we're going to see about Coxsackie virus. Coxsackie viruses. So there are two types, type A and type B. The clinical manifestations which are seen, clinical manifestations, these include aseptic meningitis, it is caused by type B. Okay, then it is herpangina. Okay, what is herpangina? It is severe febrile convulsions. Okay, it could be pleurodenia, which is the characterized by fever and abrupt onset of stabbing chest pain. So it is the pain of the chest. Okay, pain in chest, and it is of B viruses, type B. It could be cardiac manifestations, which include myocarditis and pericarditis. Okay, now we're going to see echoviruses, echoviruses. So echoviruses infect the humans through fecal-oral routes. Okay. There are 33 types of serotypes. Okay, the serotypes include 1 to 33 type. Okay, they mainly are associated with septic meningitis. Okay, septic meningitis. It could be encephalitis, or even it could be rashes. Now paraechoviruses. These are two types of serotypes mainly. Okay, mainly two serotype, type 1 and 2. Okay, now enteroviruses. It causes encephalitis, hand, foot and head and mouth diseases. Okay, it could be herpes meningitis. We're going to study herpes in skin and cutaneous infections later on. Okay, so I'll just be telling you the information which you need. Now we're going to see arboviruses. Okay, arboviruses. So arboviruses mainly include different viruses like West Nile viruses. It could be St. Louis encephalitis virus. It could be tick-borne encephalitis, or it could be California encephalitis virus. Okay, now we're going to be seeing with fungal infections of the meningitis. Okay, so fungal meningitis. So which organism causes fungal meningitis? So it is cryptococcal menoformans, which causes fungal meningitis. So there are two species of cryptococcal menoformans. One is cryptococcal neoformans and the other is cryptococcal gutti. Okay, now what is the pathogenesis? So spread will occur through the lungs. Okay, so lungs. It can even enter through the blood or different organs like the skin, the bones, or the CNS. Okay, which people are more vulnerable to this disease? So patients which have vulnerable patients. This will include the patients who have HIV or immunocompromised patients, patients who have hematologic malignancies, people who are transplant recipients. Okay, the clinical manifestations are pulmonary cryptococcosis, that is the first and the most common presentation. It could be headache, fever, sensory, memory loss. Okay, so what are the clinical manifestations? Headache, fever, sensory and memory loss, cranial nerve paralysis, cranial nerve paralysis. Okay, some others which include skin lesions. It could be osteolytic bone lesions, osteolytic bone lesions. Okay, now just revise it from your textbooks in detail, because meningitis is a very important question for NEET PG as well as for your prof exams. So we're going to end the video up to here. In the next video we are going to be discussing the lab diagnosis of meningitis. So please see that video, because lab diagnosis is a very important part in microbiology. You should be knowing each and every lab diagnosis which we perform for every diseases. Okay, thank you and have a nice day.